Now, we have not yet reached an agreement with Greater Manchester. I completely understand the reluctance of the Mayor and his colleagues to take Manchester into the very high alert level. It's far from a pain-free course of action, and it will mean a difficult time for the people of that great part of the country, on top of the restrictions they've already had to endure since the summer. But I must stress, the situation in Greater Manchester is grave, and it worsens with each passing day. On present trends, in just over 2 weeks, there will be more COVID patients in intensive care than at the peak of the first wave. So I urge the Mayor to reconsider and engage constructively. I cannot stress enough, time is of the essence. Each day that passes before action is taken means more people will go to hospital, more people will end up in intensive care, and tragically, more people will die. Of course, if agreement cannot be reached, I will need to intervene in order to protect Manchester's hospitals and save the lives of Manchester's residents. But our efforts will be so much more effective if we work together. Some have argued that we should introduce a national lockdown instead of targeted local action, and I disagree. Closing businesses in Cornwall, where transmission is low, will not cut transmission in Manchester. So while I can't rule anything out, if at all possible, I want to avoid another national lockdown with the damaging health, economic and social effects it would have. Scientists and companies in Britain and around the world have been developing new tests which are faster, simpler and cheaper. They've been working hard to discover and evaluate new testing technologies. Though there is work to do, it's becoming clear over the past few weeks that some of these new tests are highly effective and can help us save lives and jobs over the winter. We've already bought millions of these tests, some of which are very simple, meaning you simply need to wipe the swab inside your mouth and can give a result as quickly as in 15 minutes. Some of these fast tests work with saliva, and we're already using these in hospitals. We've started building the infrastructure for domestic manufacture of these tests, ensuring that Britain has the ability to produce millions of fast tests here. Over the next few weeks, we will start distributing and trialling these tests across the country. This will enable us to do quick turnaround tests on NHS and care home staff much more frequently. By testing more frequently and quickly than ever before, we can help prevent the spread of the virus spreading through care homes. And we will be able to test students in universities with outbreaks, as well as children in schools, helping us to keep education open safely through the winter. And we will make tests available to local directors of public health to help control localised outbreaks, handing more control from London to all parts of our country, so that those on the ground can use the tools we give them as they think best. And I've instructed my team to ensure that Liverpool City Region, Lancashire and any other areas which enter into the very high alert level are immediately prioritised for those tests.